The number one cause of chronic kidney disease, part 2. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. Now, I did a video a little while back about the cause of chronic kidney disease because I see it all of the time. There are pet parents, cat caretakers out there wanting to know what is the cause of feline chronic kidney disease because understandably they want to prevent it. The problem with that line of thinking is we don't know the cause of feline chronic kidney disease. And the reason behind that is it's chronic kidney disease. So that means there's not just one thing that causes a problem. The current theory is that there are multiple insults to the kidneys that over time lessen their efficacy or lessen how well they work, and that results in what we know and consider chronic kidney disease. Now we can have acute on chronic, we can have acute, I've done videos about that as well. But the overarching question remains, what is the number one cause of chronic kidney disease? And there just isn't an answer to that, at least not yet. And for the foreseeable future, I don't see there being an answer to that. So much so that the researchers have actually changed their focus. I mean, sure, would it be great to know what causes chronic kidney disease? Absolutely, we would all love to prevent it and not have to deal with it. But because studies keep coming up empty-handed, meaning we don't have one specific cause or even a couple, specific causes, the studies have basically shifted their focus. And that has either turned to, are there specific risk factors that we can look at that are going to make it more likely that we diagnose chronic kidney disease? Or once we have it, what can we do to help the kidneys? Is there something that we can use to treat them? Because at this particular moment, short of a kidney transplant, which is available, it does happen, it's just not a common thing, we don't have a way to treat chronic kidney disease. It is a management strategy. Back in 2016, there was a study done that looked at, I believe it was like 148 cats or 150 cats that were over 9 years old that had been diagnosed with chronic kidney disease. And the results of that study had pointed to really two factors that may have been relatively reliable in predicting chronic kidney disease, and one I am not at all surprised by, and that is moderate to severe periodontal disease. In other words, dental disease can absolutely cause chronic kidney disease. That really isn't a surprise to any of us. The second thing that was pointed to in this study is that too frequent of vaccines may cause chronic kidney disease. And I use that word may because the study wasn't very persuasive. Let's just say that. Now, do vaccines cause inflammation? Absolutely, that's the way they work. Do we know chronic inflammation can affect the kidneys? Absolutely, we know that as well. So is that a far jump? Probably not. However, I do not want you to take home from this video that you should never again vaccinate your cat. That's not at all what I'm saying. That's not at all what that study says. What it does tell us is that we need to use our vaccines appropriately and follow the known schedules for them, not just randomly give them to every cat every year without thinking about it. Other studies that have been done looked at things like weight loss, dehydration, general anesthesia, dental disease, cystitis. They listed those as potential things that would increase the likelihood of diagnosing chronic kidney disease. Well, yeah, of course, we know those are risk factors for kidney disease. That wasn't a big surprise. But again, not a smoking gun cause for chronic kidney disease. There was also another study done that said cats that were hyperthyroid, that were vomiting, that had a poor appetite, those were all more likely to be diagnosed with chronic kidney disease. Again, not really a surprise, and for that matter, chronic kidney disease may have caused the vomiting and the dehydration and all of those things. So some of these studies, we just start going in big circles. A lot of the studies that have been done have had a poor study design or questionable study design, and a lot of this revolves around the fact that we simply want to know what causes this problem because we want to prevent it. And as I mentioned earlier, I don't see us finding a cause so much as we need to focus on management and prevention. So when we look at things that can affect the kidneys, we can look at things like obesity and fat. Fat causes inflammation. Chronic inflammation is going to affect every aspect of the body, if not the kidneys specifically. So would it pay to focus on weight management in cats? Absolutely. That's something you can definitely do to hopefully prevent chronic kidney disease. Similarly, dental disease. Periodontal disease at its core is a bacterial infection. Bacteria that aren't supposed to be in the body are not good for it. And bacteria are going to settle out in places of slower blood flow, like the kidneys or sometimes like the heart. So focusing on your cat's dental care can be huge in preventing chronic kidney disease. Tack on to that other wellness things like parasite prevention, appropriate vaccine schedules, and you just want to create a really good recipe for prevention and wellness care. Now, I will also throw a plug out there for routine blood monitoring. If you have an adult cat, generally annual monitoring is appropriate so that we can look at what do their BUN, creatinine, SDMA values look like on a yearly basis and start trending them. If you have a senior cat, you're going to want to bump that up to every 6 months. Their year is like 7 or 8 of our years. Their lives change so fast. So as a senior, even if it is a healthy cat, you're going to want to monitor more frequently, and you're going to watch those trends. Because if you can watch those trends and they start to change, we can change how we are managing things. Rather than be reactive and get a cat that goes into acute kidney failure that then turns into chronic kidney management, if we can see it coming on the blood work before we ever have to hit the hospitalization stage, prognosis is going to be so much better. But unfortunately, the fact remains that we do not know the cause of chronic kidney disease, much less the #1 cause of chronic kidney disease, as much as many of us want to know the answer to that. So we'll stay tuned. We'll keep an eye on the research that's out there. We'll keep an eye on what we're doing with cats. We'll do the best we can to manage them, and we will learn as we go. Hopefully this shift in studies will give us a better idea of what to look for to predict this earlier rather than it being a reactive issue. Or like I said, we'll come up with some valuable treatment options to help us manage kidney disease when it shows up. Because at least at this point in time, it seems like the kidneys are just the weak link on our cats. If a cat lives long enough, at some point we're going to see that their kidneys just aren't functioning like they're supposed to. The ultimate question comes down to, does it progress to a problem, or does it just hang tight as a senior cat with kidneys that aren't 100%, but they're doing okay and they're doing their job? If you haven't caught the prior video on the causes of chronic kidney disease, I encourage you to check that out. This is part 2. I'm sure I'll do more parts in the future as we get more research. Take care.